This is the second of our hearing. The first one was, do we get a bang for the buck? In other words, we have to have a frugal government, and therefore our investments need to be very targeted. And we established that. We like to be evidence-based, data-driven. Now we're on to quality and safety, and we want to get, and I think this is what Senator Burr and Senator Casey's talked about, our colleagues have talked about. Now we'd like to get ideas from our panel on what you think are the must-do list to ensure that we can do safety, ensure quality, but also look at the budget realities that we can't have every training program we'd like to have, but we need to have a must-do list, then a should-do list, and then, gee, we would like to do list. And what you could share your insights, your experience, your scholarship to us would be greatly appreciated. I'm going to introduce Dr. Karolak, who represents, as the executive director, the Early Child Care and Education Consortium. This is an alliance of more than 7,500 early learning programs providing care and education to over 1 million children in all of our states in the District of Columbia. You led, Dr. Karolak, as I understand, the National Child Care Information Center, which was the largest clearinghouse and technical assistance program. And one of the questions I'll ask you later, I'll just tell you now, is that in the military program, we had an excellent hearing where we reviewed also military child care for information purposes. And we know that they have a hotline, a national hotline for individuals to report any issues related to safety violations or suspected child neglect or child abuse. Because as much as we want to do inspections, they might be limited by the state to 1 a year. I mean, we're going to insist on inspections and whatever we do, but there's nothing like people being on the ground. So we need watchdogs, but we don't need stitches. And I don't know if these, we all like to do hotlines. So that'll be one of the questions I ask you. But I know that you've conducted policy research and fiscal analysis in the area of child welfare. So we'll look forward to having your testimony. And we'll just introduce everybody. First, I want to say to my subcommittee, I'm really proud of everybody. Their questions are so robust and content-focused, and I think there's a spirit here to reauthorize the bill. And I'll be, after this hearing, consulting with members exactly on that. I remember before 1996, when there was just kind of a scattered kinds of child care programs. One was focused primarily, though, on those on welfare, which was the old AFDC program. 1996, this was all part of moving people from welfare to work. We had a booming economy. The internet was coming. We thought America was going to head towards full employment, and we needed to provide the support services to do it. Well, the economy's changed, and this bill hasn't been reauthorized since 1996. And there's a new fiscal reality, I think, in the United States because we spent our money on other things. Okay? We won't go into that, but we have. So where are we? And this is where I'd like to ask one of my questions. I think we have to find the balance between regulation and strangulation. Regulation where we really insist on proper standards for safety and quality, and at the same time are not so rigid, one size fits all, out of Washington, regardless of the size of the state or the demography of the state. And then we have what I call underground daycare. For all of us who know and have worked in child welfare, we know that the thing that we would fear the most is children in environments where there is no supervision, no nothing, actually, and they are truly our vulnerable population. So that's where I'm heading. So let me go to the safety questions. And then the other, one of the big bugaboos, beside money, is mandates. Wherever you go, whether you're talking about the reauthorization of Title I or this bill, they say, oh God, whether you're a governor or a provider, don't give us more mandates. So we need to have local flexibility and yet national standards. So you see where I'm heading. So let's go to the safety. I think there is this sense that there should be, as Senator Burr has done in his bill, really background checks on those people we know will get government money. If government's going to help pay for it, government should insist that people are fit for duty. And one of the criteria, of course, is that you do not have a record of abuse in any kind of area. So that would be number one. But the other goes to inspections. Now remember, states can only spend 4%, I think, on quality. They're limited on administrative funds. The DOD bill, you know, if you're in money from the Department of Defense, they mandate 4 inspections a year. I would imagine if I called the dynamic woman who was the governor of North Carolina, Governor O'Malley, they'd say, Barb, love to, but just can't do it. What do you think are the adequate number? Do you believe that inspections of facilities are a necessity? And how frequently would you recommend them to be able to do that? I'm talking now about safety. I'll get to quality. Do you have a recommendation on this?
Well, I'll jump in again from the perspective of a direct provider currently, as well as someone who's dealt with those issues on both sides, both as the regulator and as the regulee. Is that the word? The person being regulated.
Anyway, what's the recommendation?
Anyway, I do believe inspections are incredibly important. I think they should occur. I think that even perhaps once a year is not necessarily good enough. I see the drill my own staff go through when they know it's time for an inspection. Things get really good when they know.
So that's an announced inspection.
That's when they know that it's time and it's coming at some point in the next few weeks or months. It's sort of this mindset. In order to afford it, what we're trying to accomplish in terms of on-site inspections, I would like to see us look down the road to ways in which we can be combining and joining forces with others who inspect. The program that I run, it's a licensed child care facility, so it's inspected by child care licensing, it's inspected by the food program, it's inspected by the state, actually the local arm of the state health department, it's inspected by Head Start, and it's inspected separately by Early Head Start.
So you have multiple
Same federal
inspections.
agency, and it's inspected by the HIPPY USA, because we use the HIPPY curriculum, and it's inspected by Denver Public Schools because we are a Denver Public Schools Colorado preschool program provider, and now we're being also inspected by the Denver preschool program. So we are inspected by funding stream, if you will. We are an incredibly high-quality program. We have all the stars you can get. We'd have more stars if there were more stars in Colorado's QRIS. We have incredibly clean, every 3 years, Head Start and Early Head Start. There are never any findings in this program, and yet I am monitored by everybody and their brother. We're spending a lot of money.
Ms. Brantely, I'm
on
going to jump in here.
monitorings.
First of all, that was very insightful. And I'd like you, really tremendously insightful. And I'd like you, because you are an actual hands-on provider, give me a list of everybody that inspects you.
Okay, I'd be happy to.
Because I think this is important, and I know it's exactly the kind of thing that Senator Burr is keen on. Needless duplication and
Yeah.
so on.
And I think that the Office of Child
and
Care
let me
is
just go to
doing
my
some
next
looking at
point.
that as well.
And let me go to my next point, though, because I think that in addition to, you're already inspected. So one of our ways of thinking about it would be how certain inspections would deem appropriate for everybody, okay? And it'll be complicated, but there'll be another way, or make it for states to be able to do this. The second thing would be what I call good guy or good guy bonuses, that if you're inspected and, gosh, you're like you have multiple inspections every year, but some need more frequent inspections. In other words, the worse the record, the more frequent the abuse. Inspection. So some might have to have 4 visits until they right their ship, and someone like you might have to only be inspected every other year. And I think there has to be a reward system. I'm a carrot and a stick kind of gal. So I think those are, would you think that's a good way to think about it?
I do think that there is some value in that. I also think, again, figuring out, and I will provide you with that list, I think figuring out where we can cut out the duplication would actually make it much more affordable to do those.
And perhaps make it
much more-
flexible to the states to come up
Yes,
with that system.
yes, right.
I think where we all agree then is less Washington mandates, but certainly descriptive rather than prescriptive. Now, Dr. Karolak, that takes me to you. And you were the hotline guy. Was that hot? You ran a hotline.
Well, there is
You run a hotline providing technical assistance?
The technical assistance network that the Office of Child Care operates includes a hotline to help connect parents with providers. Your question earlier about could you report concerns about safety through that line, I'm not entirely sure. I'm sure if you did as a parent, they would get the appropriate attention. That line is manned very well, or staffed very well.
Do you like hotlines? Do you think they work? I used to love hotlines, but now I wonder, do hotlines really work? They work in the Violence Against Women Act. We know that over 1 million women, when in the original Biden legislation, have used it, and it's been enormously successful. But
yeah, I think there's something worth looking at in terms of how that hotline that exists can be promoted to parents. Of course, you need to inculcate in parents an understanding of what quality is, what things to be concerned about when it comes to safety.
now I'm talking
in a
about the
relationship.
guy that delivers the bread, and he just thinks something's funny every day.
Sure.
Okay?
That
I'm
would be
talking
helpful.
about really what a hotline is. And again, that's the delicacy between reporting and snitching and retribution, because there's a lot that goes on in communities.
It would be good to have a way for anyone who's got concerns about a particular program, something going on in the neighborhood, to be able to report that. I think that's probably a very good idea. I do think that ultimately it comes back to then what does someone do with that information? And that requires, we were talking about inspections, for example, and the workload that goes with that. That requires having folks able to go out on the ground to look into matters. I like this notion that you triage inspections so that problem providers get a little more attention. And some of the best programs maybe aren't given full inspections. There's key indicators that are focused on. And that is a way of triaging some of the workload. But a hotline will only identify something that needs to be followed up on. And so there's an
That's
issue
pretty
there.
good.
Oh, absolutely. It might be a way that a program...
That could be an option for a state to establish. That, in other words, rather than a national hotline, then you get into privacy, who follows up, who tells who, more bureaucracy, more that to enable a governor through their legislative body to think about that. What do you think, Senator Burr?
I think you're onto something. I would caution all of us that hotlines in some cases can be used as a reason not to act, not to institute certain requirements that common sense tells you ought to do.
Like an inspection.
Like an inspection. I might say for the record, North Carolina does require 4 inspections a year. So we hit your threshold. And
I tell O'Malley about that. It's bad enough we have to put up with your basketball teams.
you've got quite a football team up there this year based on how they played
And
against Miami.
fashionistas, I might add.
But I think you raised 2 really important issues, and that's how do we support the right policy? How do we reward people who go above and beyond from a standpoint of a quality institution and hopefully coordinate to where it's not overload from a standpoint of reporting or inspections? And how do we supplement the public's participation in the assessment of quality facilities or at-risk facilities, I might say? And I think there's a way to publicly promote that, but it does have to be done at the state level and not at the national level.
I think that's something to think about. Now, my last point, though, is about training and quality, because I think the consensus of the experts here is that the thresholds is that in order to get quality, you have to have people who know what they're doing. Now, the average rate of pay for a child care worker in the United States is under $25,000 a year. They often make less than the people who are getting the subsidy. So this is an issue. And I'm not commenting on the pay or et cetera. I mean, we would all like it to be higher. And then so to ask them to pay is, I think, a burden. So the question is, what is it we require, and what is it we require at what level, and then who pays for it? And the question is, do you have minimal accreditation standards, licensing standards? There seems to be a difference between accreditation and licensing, and so on. And yet people have to be trained. And yet, is it the teacher? Is it the college graduate? Is it an assistant who's not a college graduate but loves children and has a unique way? You know, we're talking about children like everybody's going to show up with shiny bright eyes and toilet trained and ready to go hoo-ha and give me that jar of Play-Doh. Many of our children have significant physical challenges, now a growing emotional challenge, particularly with the high rate of autism, particularly among our little boys, growing up to be big boys. That's an enormous, enormous challenge. So what do you think about that? Do you think, how rigid do you think our training should be? Right now, there are no training standards.
You're right that the teacher is the most important. We do have standards that have been developed in almost every state, I think, for early learning, what children should know and learn. And we need to connect what teachers get taught so that they can teach to those standards. I think that licensing, just to clarify, licensing is what states do. When we say accreditation, typically we mean accreditation by the National Association for the Education of Young Children or one of the other national agencies, and that's usually at the high end of quality. So state licensing is sort of the baseline quality, and you would hope to achieve national accreditation. A nationally accredited, many states' QRISs say if you've achieved national accreditation, you're at our top level. So, got off track. For teachers, I think that it has to be individualized where they are. And I think that I want a college degree for every teacher because I think a college degree is the coin of the realm in our country. It's a human capital issue. It doesn't guarantee good teaching, and so they need training, technical assistance, consultation, whatever you call it, and possibly some of that's going to occur in a college classroom or a community college classroom. Teach is a good way of funding it, but again, it's one of those dollars versus leaving people where they are issues. So, wish I had a solution.
This will be my last question. Dr. Karolak, what do you think about that?
Well, first, I hesitate to add anything to what Dr. Bryant has to say on this subject. She's a far greater expert than I am. But I would say, and I think I know this is borne out by the research, that we know that the more early childhood specific training and education a provider receives, the better the work that she does and the better the outcome, the experience for the child. And so I think that as we think about licensing standards, having states require pre-service and ongoing training requirements that include early childhood development specific training is very important and is a way of making sure that the workforce that is there and its experience is embraced and is developed in a kind of continuum that Dr. Bryant mentioned. I think it's important to also note that that wage level which is really the end point that we're trying to get to when talking about that, is a function of the public and private dollars that are available in the child care arena, in the early learning arena. And unless we see some great change in the valuation, you mentioned stock of the coin of the realm, unless we see a change in the valuation of early childhood development in society, it will be very hard to move that wage level without some significant help from Washington.
Well, I think that's an enormous challenge in today's fiscal climate, but it is worth consideration. One of the things that we note, though, in nursing, that there is a continuum of certification. And whether it's the certified nursing assistant, the licensed practical nurse, the 2-year person from our community college that performs an important role, to the 4-year bachelor's, to then a sophisticated master's degree nurse practitioner, like in an outstanding school like Chapel Hill or Hopkins or University of Minnesota. But there is a continuum, and they're called upon to perform different functions. Now, often we know a hospital, an acute care, or a nursing home. Again, these are larger institutions with a lot of public participation and so on. But I think that there are lessons learned where we look at kind of a continuum and then also establish a career ladder where if you enter at one level, that you can then move to another, and then that level takes you to another over your own time as you progress. And I think this is an area, I think we can get a real clarity on the safety issues with good ideas and local flexibility. But I think this education, as well as the funding, is going to be one of our biggest.
Madam Chairman,